Stigma to me is looking at a person for something that they have or something they don't have and treating them differently because of that.
I think everyone does it, even I do, at times. It's judgment of someone before you even know anything about them.
There are lots of examples. I mean, people who are obese are stigmatized in our society, people who are too tall or too short. And of course, there's mental illness, which is something which is highly stigmatized.
Stuff like incompetent, stupid, crazy. That's one I hear a lot.
Simply put, it's discrimination and prejudice.
Not so much in a mental health setting where you're going to see the psychiatrist or you're going to an outpatient mental health clinic, but certainly when you go to an ER.
You go in, and once they find out what you're there for, you're treated differently.
And as soon as people hear the words like, Prozac, Seroquel, Ativan, any of that, it's almost like this wall goes up.
People assume too much.
And it may have nothing to do with their mental illness, and yet they're still, think that they're seeking attention. And what they maybe really have is, a sprained thumb or something.
I've heard nurses talking when they didn't think you could hear. They were saying, she's a drama queen. So she's dismissed before any treatment is even considered.
People who label people like that don't really take their concerns seriously.
The small behaviors that people can do, like, the eye rolling and the snide comments and the dismissiveness and, the gossiping, it makes a huge difference to somebody who's in a very, very sensitive situation, who already feels very, very poorly and very, very afraid, to have the people that are supposed to be helping them, essentially not really treat them very well. It makes a huge difference.
There was a young woman who really needed some extra care. They were to the point where they were going to change physicians because they didn't feel like their physician was hearing what they needed. And when I went out to the physician and I spoke to him, and he said, "Oh, she's crazy." And I said, "Oh no, she's not crazy. She has mental health issues that need to be addressed. You wouldn't say that about somebody with diabetes, or you wouldn't say that about somebody with cancer. But because it's mental health, she's crazy. And this is what she needs." And he went into the room, and he apparently was quite different when he went in. Because the mother said to me, "What did you say to him?" And I said, "I just expressed your needs to him. I didn't say anything extraordinary."
Going into the emergency department for, severe mental health problems because you really have nowhere else to turn, and essentially being treated like you should have tried harder, or you should have done better, or you're wasting our time. And it's weird when I compare it to the experience when I broke my ankle, because I was in and out in 3.5 hours. I wasn't even in the waiting room. It was just like, "Oh, that's broken. Here's an x-ray. Okay, here's some drugs. Go home. We'll call you for surgery on Thursday." And it was just like, I'd never had that happen in my life. I was so surprised.
The youth are labeled by their teachers, by their peers. They're bullied, made fun of.
Because there's so many misconceptions out there, then I was so afraid to say anything and tell people what was going on inside my head because I was afraid of what everybody else was going to say.
People do not want to believe that mental illness occurs in their family or in their patients if you're a physician. It's always somebody else's family, somebody else's patients.
People don't know how to deal with people with mental illness. They're suffering just the same as somebody with pneumonia. They're suffering just as much as. The system does not take care of people who have mental health issues. The system labels them, and what causes them to be or behave in a way that leads to somebody giving them that label is never addressed.
I'm a person first, and I'm a diagnosis second. And that's like the message I wish I had been able to convey when I was younger, when I was very much being treated as a problem, not a person with a problem.
Jessica was a happy little kid, and when she was 12, in grade 7, she developed all these physical symptoms that were preventing her from going to school. She had headaches and stomach aches and nausea, and she was admitted for assessment of her physical illnesses. When they couldn't find anything, they did a psych assessment. And at the end of the day, I was told that I had a spoiled little girl and to take her home and smarten her up. And of course, a psychiatrist, stupid me at the time, a psychiatrist told me this, so I believed it, even though this little voice in my head was saying, you know that this isn't true, you know this isn't true. But off we went, and as a result of that misdiagnosis, based purely on prejudice, I felt, Jessica ended up with 16 years of anorexia, bulimia, self-harm, failed grades, unemployment, isolation from her family and friends, extreme physical ramifications, despair, and suicide attempts. And so way back then, if her anxiety disorder had been properly diagnosed and treated, all of that would have been avoided. I don't understand why that happened. And I have spent a lot of time thinking about it. I still get very angry because I see what it did to my daughter and to me.
Mental illness, can be fatal. And when it is, it's never captured under mental illness. It's always captured under whatever they died of, whether it's asphyxiation or whether it's, exsanguination. But it never says died of hopelessness. And at the end of the day, that's often what it is.
When you've got a broken bone, you can see the x-ray, you can see that it's broken. When you've got to go in for blood work, you can see the blood results. You can see what's really there. When you've got to go in for psychiatrics, there's nothing that you can see. And I think so that because there's nothing that shows you what's really there, there's a lack of understanding.
These healthcare professionals, their opinion on the mentally ill, I would say, starts before they go to med school, before they decide they want to be a doctor. They've been hearing myths and, I don't know, just labels all their life. So I'm sure they just carry that with them into their training.
I had the dream team. As much as people told me that I wouldn't make it to graduate high school, I'd be dead before I graduate grade 12, these two told me that I was gonna make it. They just kept believing in me. No matter what bad excuse I came up with, that they just kept believing. Even though today they're not professionals in my life, I know I can send an email along to them if I run into any kind of trouble, and they're there. They'll pick up the phone, they'll give me a call, and they'll give me a little bit of support to keep me going. They're phenomenal.
I've met a lot of great people and great doctors, other patients. How I can feel when someone cares or is listening, for me would be when, I guess, they take an interest in what I'm saying. They pursue what it is I'm saying. I've been pretty lucky through despite what I live with and what I go through on a daily basis, to receive the help that I've been given.
I remember in particular being in an emergency room and really not having an easy time and really, feeling very out of control. And this nurse came in and started talking to me, and she's talked to me for 45 minutes, just about her family and about myself and about what plans maybe I would have for the future, and about how, her sister had a mental health problem and gotten through it all okay. And at the end of it, she gave me a hug, and I suddenly realized she'd stayed 45 minutes after her shift just to talk to me. And I was like, wow, I've never forgotten that person.
We can do it by asking the questions, by being receptive.
If they're telling you something's wrong, believe something's wrong, don't think they're lying to you. Don't be closed-minded. Be patient. Always be patient with them.
the best time to treat mental illness with youth is early on. Like, early intervention is the key to successful treatment at this point. What's happening is people aren't getting treatment until they're in complete crisis because they don't want to go and encounter the stigma or the system is completely overloaded. And that's why we need to have less stigma for youth, so they get better treatment faster, so they don't end up having a lifetime of problems.
I really believe that there needs to be more education on the medical side of things as far as mental health is concerned.
And I think that we have to do a better job of trying to understand better how pervasive, how common, and therefore not stigmatizing is mental illness. And I think the more we talk about it and the more we understand it and the more we have practical examples of how it's an everyday occurrence at some level, then we destigmatize it and we deal with the issues and try to make people better.